Your family, your health, our passion. This is Family Practice with Dr. Jeffrey Fox, sponsored by Family Practice Associates of Lexington, PSC. Visit us at fpalex.com and like us on Facebook.
Welcome back. My next guest is Amanda Shackelford, who is a nurse practitioner with Family Practice Associates, and she's the resident expert there with GLP-1s and weight loss. Welcome.
Oh, thanks for having me back.
So tell us what a GLP-1 is and actually how it works.
Yeah, so essentially these are the newer medications that we use for diabetes and weight loss medication. We all have a natural hormone occurring in our bodies called GLP, or glucagon-like peptide, and essentially what these medications do is they jump on the receptors and they mimic this hormone that we already have. So what they do after we start eating, our body, the GLP releases, and it sends signals throughout our body. It sends signals to our brain to decrease the appetite. It sends signals to the brain to tell us that we are fuller than we are. It sends signals to the intestines that it slows down our stomach when the food's in there. It also sends signals to the pancreas, essentially increasing that insulin production to lower the blood sugar, which is great for diabetics. And then it also decreases the glucagon release, so essentially the liver will release extra glucose into our bloodstream, so it kind of prevents that from happening too. So with all these different signals throughout our bodies, we're taking less food in, we're getting fuller quicker, we're staying fuller longer, thus we see some of this weight loss.
What kind of weight loss are we talking? We talk about 1 pound, 20 pounds. How long does it take to see an effect?
Yeah, and this is nothing that's going to happen overnight. We can usually expect anywhere between 10 to 20% weight loss for most patients. I have several patients that are on these medications, and it's typical for them to lose about 1/2 pound to 2 pounds a week. Of course, the more obese patients we do see more significant weight loss because there's a lot more to lose there. But usually about 10 to 20% of overall body weight loss is what we see.
Now, we know they're used for diabetes and obviously for weight loss, that's the big thing. Do they also have some other health effects that might be beneficial? We
have found a lot of great benefits for this. It's definitely good for the heart. The American Heart Association just released that these medications are first-line treatment for obesity. It's great for diabetics. It's great on the kidneys. We're seeing better kidney function. It just got an indication for fatty liver, so definitely helping with that. All of these things are great. More weight loss is more weight off of the joints, so we're seeing decrease in these joint pains, these chronic inflammatory processes. They work wonderful.
Obstructive sleep apnea, I hear too.
Oh, that's a newer indication. We're seeing significant changes with sleep apnea.
Okay. Now, all those are good things, and we love to hear about, but are there side effects?
Just like any other medication, there are going to be side effects with the GLPs. The more common, less side effects, nausea, vomiting, diarrhea, constipation, hair loss. These are some of the more common ones we see. Some heartburn, some serious side effects, bowel obstructions, the bowels getting blocked, bowel perforations, little holes in the intestines. Then also a risk for pancreatitis, which is a pretty painful inflammation of the pancreas, and then a potential for thyroid tumors. So, if you have a personal history or family history of thyroid cancer, these medications unfortunately are not for you.
So let's talk a little bit about the cost, because that's a side effect too, I
guess.
Yes,
that's one of the major side effects right now. Some insurance companies do have it on their plans that they will cover these, but we're seeing a lot less coverage nowadays for the weight loss options. They're still covering it for the diabetes, but for strictly weight loss, a lot of coverage was lost at the beginning of the year. So these normally range between $900 to $1,300 a month. With manufacturer coupons, most, like Wegovy and Zepbound, both have manufacturer coupons that can bring that self-pay cost down. There's also GoodRx, TrumpRx. They provide a little cost savings as well. So with these, coupons, they can run between $140 and $550 a month.
Okay. Is the pill and the injection work the same?
So essentially the pill is a GLP, just like the injection. Instead of doing it once a week, you do it daily. There is not as much weight loss associated with the pill, but it's great for those who have fear of needles or needle aversion.
Well, thanks for coming in. Thanks for telling us about it. And thanks for all the help you give the patients with their weight loss.
Yeah, thank you.
We'll be right back.